I think it is okay to use animals for basic research. Essentially, it's done to find out how the body works and the sorts of things that can go wrong and the sorts of things that keep humans and animals healthy. It's a little bit like building the foundations of a house. If you don't do it, when you come on to do more applied work looking at specific illnesses and conditions, you don't have firm foundations on which to build, so you haven't got the underpinning. We've made all sorts of progress in basic research. We know an awful lot about the way in which the blood system works, the heart, the lungs, the circulation, hormones, the way that organs grow in the body, the way that tissues grow, all those sorts of things. And there's also an awful lot that we don't yet know. For example, the brain is probably one of the holy grails of basic research. I used to do a lot of research myself on the very basic mechanisms of how brain cells talk to one another. And one of the ideas behind that was that ultimately it would help us to understand conditions like epilepsy or stroke or pain. After doing that work, I then went on to work on motor neuron disease. It was doing that sort of work that made me realise how important the basic research was, and seeing patients with that condition just reminded me how important it was that we understood the basic mechanisms of how the brain worked, so that we could then go on and do that sort of work which is aimed at understanding, treating and curing specific illnesses. So yes, I do think that it's okay to use animals for basic research, as long as we keep an eye on ultimately where it's heading, and that, like all medical research using animals, is for patient benefit.